It is my esteemed pleasure to present today's workshop and hosting both Breanna Hawkins and Debbie Sheen, who will be talking about ways to support equity in our communities through some of the innovative work that they've been doing in their respective works. Breanna Hawkins works for the Chief Executive Office in Los Angeles and is working on work related to anti-racism, diversity, and inclusion. Debbie Sheen is a senior program officer with First 5 LA and principal owner of Fractal Strategies, really working to advance health equity and health equity principles to really support the authentic community engagement for families and communities across Los Angeles County. Both these phenomenal women have done work statewide. They are advocates, champions. They are former colleagues of mine. They are dear to my heart, and I cannot wait to hear the dynamic work that they will share with you as they talk about health equity and how we can really learn from our partners in LA County to bring some of that work here to Kern County and other parts of the Central Valley as we think about supporting community and the work that we are envisioning to do together and collectively. So without further ado, I will hand it over to these wonderful, phenomenal women to start our presentation and allow them to introduce themselves.
Wow, I always want to be introduced like that. Can you just write that down, and Breanna and I will just hand it to the next workshop and have them introduce us with as much love and joy as you did. Thank you, Hector.
Yes, thank you so much, Hector. Really an honor and a privilege to be here with you all in Kern County. You know, the plenary session was really dynamic and talking about the various comprehensive ways to not only just recover from the pandemic, right, but recover better than before. And I think innovation and centering health equity is a really critical component of that. And we are excited to be able to share about some of the innovations coming from Los Angeles County that, you know, can be looked to inspire and hopefully help catalyze, you know, innovation in Kern County as well. We hope that this is a conversation and a dialogue, because we'd also love to hear from you. We know that there's innovation happening everywhere. And I think one of the ways that it can really be shared is through discussion, through interactive conversations, and just talking about some of our respective lessons learned and in our journey along the way. So greetings again, everyone. I'm Breanna Hawkins with the Anti-Racism, Diversity, and Inclusion Initiative in the Chief Executive Office, and I'm pleased to be joined by my colleague, Debbie Sheen from First 5 Los Angeles and from Fractal Strategies. As Debbie mentioned, we want to know who else is in the room as well, the virtual room. So please add your contact information, your name, your introductory information in the chat, as we'd love to learn about, you know, all the diverse stakeholders that we're speaking to. I see some folks from the school district, from the health department, from a variety of different systems, community-based organizations, a variety of different systems that are contributing towards improving conditions for young children and families. And so we're honored to be in this space with you. I'm going to start off our presentation by talking about some of the work that the RD team is doing in Los Angeles County around recovering better than before, and how we're centering health equity and really designing new and innovative ways of how the county can do business. And what that means for young children and families who have been most impacted by systemic inequity. And then Debbie Sheen is going to talk about what community-led solutions for addressing social determinants of health look like in the context of First 5 LA and the place-based strategies that First 5 LA is advancing through Best Start. And then we want to open it up. We really want to spend a majority of the time here, as I mentioned before, in conversation and discussion with you, fielding your questions, and then also just learning along the way. Please feel free to post any questions or comments or reflection you have in the chat as we present, and we will be sure to get to those during the discussion as well. Before I get into my overview of the work that in Los Angeles County and the RD initiative, Debbie, do you have any other introductory remarks that you want to add?
No, go ahead, Breanna.
All right. So the Anti-Racism, Diversity, and Inclusion Initiative in Los Angeles County is really a fairly new initiative that started in July 2020 with a unanimous board motion that created the board's 8th board directed priority to establish this initiative in a bold move that articulated an anti-racist agenda that will guide and govern the county's ongoing commitment to fighting racism in all its dimensions.
While the right one?
This initiative is definitely, one that is innovative and new in the county's intentional commitment to addressing anti-racism head on. It also builds upon a variety of efforts that have taken place since 2015, and really even prior to that, back to the 1940s, where the county board of supervisors took special legislative action to really operationalize equity in its forms. And this initiative really builds off that work. Now, addressing such structural racism is a critical component of the work of ARDI. And we really think about structural racism in 3 forms. The institutional component, so the role that government and public agencies have played in really creating and perpetuating racism and inequity that disproportionately impacts particularly communities of color, LGBTQIA communities, communities across gender, ability, and other identity groups. But there's also spatial racism that manifests in the way the built environment is reflected in the way it's formed, and where, regardless of income, why African Americans still have to travel 20 minutes in Los Angeles County to reach their preferred grocery store, while, folks of the same income level, you may only need to travel 5. And then relational, the social networks, how we interact with each other, who our networks are also can manifest and also uphold the pillars of structural racism that contribute to the inequities that both individuals and families experience today. These social processes have manifested in things like exclusion, exploitation, and control, and ultimately contribute towards not only disparities in one's lifetime, but generational disparities that can manifest across the life course. So while structural racism may manifest in inequitable access to early care and education for low income or families of color, that can contribute towards lower grades in middle school, not attaining high school diplomas, that can ultimately impact income prospects as in adulthood, and sort of contribute to the cycle of generational poverty that continues to uphold the pillars of inequity that families face today. And we can see these across a number of indicators, including, income, employment, wealth, crime, and incarceration. So our work really centers on advancing equity, inclusion, and anti-racism. And, our understanding of equity is distinct from equality, but it doesn't just get rid of the concept of equality at all. We believe equity is really the vehicle to be able to achieve equal outcomes. What it does is it recognizes that different people have different needs. They have different conditions that they're starting from. They have different factors that have impacted where they are today. And in order for us to be able to achieve equal outcomes in the opportunities that people have, the resources that they have access to, we have to have tailored solutions that are tailored to the specific needs of those populations in order to achieve those outcomes. And that's really what equity looks like. And racial equity, takes that concept a step further and says, regardless of race, that ultimately everyone will have the ability to experience society's benefits, no matter what color their skin. And anti-racism is the active process of identifying and eliminating those systemic barriers that we talked about earlier that contribute toward the racial inequities that we're trying to overcome through the policies, systems, and practices that we implement. So the work that the Board of Supervisors did to establish our initiative really concretizes that effort and codifies it in a way that builds off of their declaration of racism as a matter of public health in Los Angeles County, and talks about the need of our initiative to be able to contribute towards the establishment of policies, practices, and programs that can contribute towards a racial equity lens throughout all of the county's work. Recognizing that racial equity is one component, but there's also many facets of equity that we want to be able to include and focus on as well. And many of our initiatives are aligned with that as well, including developing management and appraisal performance plan goals for department heads, where they have to achieve these goals in order to meet their performance evaluation benchmark.
I want to turn this volume on.
Government ultimately plays a significant role in being able to overcome some of the racial inequities that contribute towards the disparities that we see today. Recognizing that government, again, has designed and helped to create the problem that we're currently in. The government and philanthropy both can play instrumental roles in rectifying those inequities. And what that looks like is recognizing the role of systemic racism formally, and committing to changing the systems and structures that hold racism in place, co-creating solutions with the populations most affected by adverse outcomes, and then utilizing a racial equity lens to inform future decision-making. And that can look, manifest in a lot of ways, including equitable access to childcare, school quality, lower childhood rates, alternatives to incarceration, et cetera. And so, we've been able to do this work in partnership with a whole host of partners, including the various 88 cities within the county, the 80 school districts, 120 unincorporated areas. And we do it through providing technical assistance, a policy analysis, and equity-infused programming and resourcing, which is what I'm going to really focus on today as we talk about the efforts that we've embarked upon to recover better than before from the COVID-19 pandemic through the implementation of the American Rescue Plan. So as previously discussed, there have been many responses to the COVID-19 pandemic that has plagued our communities respectively, over the course of the past few years. And we know that with the initial federal government response to COVID-19, there was the CARES Act, which was a distribution of a significant amount of resources to communities, but wasn't necessarily distributed in a systemic way. What we saw in LA County, when we looked at the rates of COVID-19 rates, was like affluent communities actually had the highest rates of COVID-19 initially. And then what we saw was that because they had more access to protective factors, like being able to work from home, they didn't have to be essential workers. They didn't have to send their kids over to a public childcare, but can have in-home childcare, or could be able to provide that childcare themselves, that they reduced the amount of exposure that they had. And then we saw the rates spike in the communities of color and low-income communities, really impacting young children and families that were in impoverished areas and also in areas primarily comprised of communities of color. However, the CARES Act dollars in Los Angeles County primarily went to those affluent communities, and those communities that were most disproportionately impacted did not really get to benefit significantly from the distribution of those federal resources. So the American Rescue Plan was really an attempt to rectify that inequity. And the federal government really was intent upon ensuring that the distribution of these resources were equity focused, prioritizing the communities that were not only most impacted by the COVID-19 pandemic, but that had experienced historical and systemic inequities prior to the pandemic that were exacerbated because of both the health, social, and economic crises that impended upon communities as a result of the pandemic. There were requirements for the distribution of resources to be community empowering, to be worker-centered, and to also be rigorous, to be results and evidence-focused. And the County Board of Supervisors took this even further and said, you know what, we're about to receive $1.9 billion. And not only that, but there's also the federal infrastructure bill that's coming. There's the Build Back Better funding that's most likely will be approved. There's going to be an unprecedented amount of federal funds influxing into our community. And there's an opportunity that we have to do things differently. And instead of just dividing by the 5 districts that currently comprise of Los Angeles County, we can prioritize the resources in the areas that really need it the most, so that we can achieve the equal outcomes that we all want to achieve for Los Angeles County residents. So they require county departments to abide by a series of equity principles, to develop an equity index that would inform how the resources would be spent, to develop equitable project designs, and to create a public-facing dashboard and mapping tool that can publicly share and display the outcomes of the many projects that were designed for the American Rescue Plan and for COVID-19 recovery to the public for accountability and transparency. Some of the principles that were identified collaboratively with both community partners and county departments include focusing on closing racial and gender gaps as root causes of and drivers of inequities, to ensure that regardless of documentation status, that anyone had access to the programs and services, to ensure that they could departments could contract with CBOs based in the communities that they were trying to serve, and not just those with the highest capacity, but with those with the greatest expertise in the communities that we wanted to target the most. Services must be culturally and linguistically accessible, and that funds shouldn't be used to advance oppression-based efforts via incarceration or over policing, but really about partnering with community to address some of these inequities. And so what we were able to do is, with those principles, design more equity-centered projects. And we partnered those principles with this equity tool, the Equity Explorer, that we partnered with Esri, the ArcGIS platform, to build. And this includes a layer, multiple layers that can support departments in determining where they want to place their projects. And this is a publicly accessible tool. I can include the link in the chat. But essentially, the tool it provides information on which census tracts throughout Los Angeles County might have the greatest need in alignment with the priorities of the project that was developed. So for example, if there was a housing and homelessness project, you can see the tenant vulnerability index to determine where are tenants most vulnerable for being displaced or for homelessness based upon, the either rates of rising rents and the income levels. And how can we target solutions for those census tracts versus just blindly saying we're going to divide them into every part of the county, not necessarily based upon need. And so they're able to utilize this tool to really target strategies and inform how they will conduct outreach, conduct service delivery, and who they'll partner with to be able to distribute the services. And so what this looks like now is we have, the $1.9 billion dollars distributed across over 80 projects in 17 departments focused on homelessness, stable housing, food resources, affordable housing, direct community investments, 50 million focused on healthy families, small businesses, and then safety net programs. And we're able to show, which departments are working on them, how many of them are grants or projects, how many of them are focused on areas with the highest need versus high need, moderate, low, or lowest. And the board wants for 40% of the dollars to go to areas with the highest need, 35% with the high need, and only 5% in census tracts with the lowest or low need. And then also, we are publicly sharing information about the types of projects, who the target populations are, and also key outcomes, like what are the outcomes related to early childhood and economics, or housing and household assistance. And we're able to share that publicly with our partners to hold us accountable along the way. And so this is a collaborative effort that has really been developed not only, with the American, the Anti-Racism, Diversity, and Inclusion Initiative, but with our Community Input Advisory Board comprised of community leaders across Los Angeles County, with the various departments that have been involved with the American Rescue Plan implementation, and then also learning from other jurisdictions about the work that they've been doing to implement these programs. And what we've seen is that by prioritizing, doing things differently, not just doing things because we've done them this way before, but really focusing on where the needs are and directing the resources towards those areas with needs, that we have an opportunity to affect catalytic change and really improve the health conditions, not only for children and families today, but have generational impacts on children and families to come. So with that, I will pass it over to Debbie to talk about the work at First 501.
So before I do that, Ameta had a question in the chat, specifically about when you mentioned culturally and linguistically accessible, or maybe targeted. I think you were talking about in reference to the dashboard. So maybe you could go back and address that, because that seems specific to that dashboard.
Absolutely. So we know that when we talk about equitable access to services, we're saying that services need to meet the respective needs of the populations that they're serving. And, you know, Los Angeles County has over 23 dominant languages that are primarily spoken throughout the county. And if we only have services or resources available in English, or maybe even if we only have them in English and Spanish, that doesn't necessarily meet the needs of all of the populations that we're trying to serve. So hiring people that have the linguistic capabilities to be able to meet those various populations, disseminating outreach materials in a variety of languages is another way, and our public health department has a real intent program on that. Also, you know, thinking through some of the cultural accessible components as well, recognizing that you know, there may be some programs that need to be tailored to the specific cultural needs of the populations that they're serving. So, for example, reaching African-American populations on housing and homelessness services, we found that traditional practices are not necessarily effective. But if you go to places like churches, if you partner with churches, if you partner with community-based groups, that you're able to better reach them than if you just only focus on the public department's outreach solely. And so that's sort of what we mean by having both culturally and linguistically accessible programs and services. And then the question on how we gathered all the data that we've been able to show, all of these filters are actually publicly accessible resources. And so we've been able to find them on federal websites. Some of this is census data. Most of it is actually census data, and also using other indices. And we've aggregated them all on this one tool to make them really accessible for county departments and also our public partners to be able to access. In regards to the data that we're reporting on through the dashboard, we actually are collecting that from the project designs that departments are developing. So when they're designing their projects, they have to fill out a form that includes questions on how they're thinking about equity, on what their target outcomes are, and what their metrics are in measuring progress along the way. We work with them to refine those project designs to meet both the federal government and the county's equity standards. And then we publicly report them on this website. So we're actually collecting data from the departments and their subcontractors monthly after they've been launched on sort of the status, any outcomes that have been derived as a result of the project, and also, you know, who their target populations are and who is actually being reached as a result of those projects. So I can definitely talk more about that in the Q&A if you have additional questions. And I'll also post a link in the chat right now so that you can look at the resources for yourself. Thank you. And with that, I can turn it back over to this tool currently is just LA County. However, we built it off of Advancement Project California's tool, which is a countywide tool. And so I'll include the link to that as well so that you all can have access to that.
Okay, thank you so much, Breanna. Breanna and I have been friends and colleagues for a long time, but never failed to be in awe of the work that she does to drive equity in our communities. So my piece is really going to be shifting to a different level of equity driven work, which is around community-led solutions. And so Breanna talked a lot about the county level and what policies and practices are being implemented in the county level to drive better equity in our communities. And I'm going to just shift now to talk about community-led responses. So we can go to the next slide. And this section is really all going to be about how do we center on community experiences and specifically the expertise of our residents and parents and caregivers, acknowledging that parents and caregivers are in the best place to make the decisions for their families, really centering on their experience. And so when we think about, if you think about your childhood and the neighborhood and community that you grew up, Most likely you're going to think about the home you lived in, the community, the streets, the access to the parks that you went to as a kid. You might be thinking about the meals that you shared with your families and the grocery store that you were able to get to, however far it is. And you might also be thinking about, how did your family get from place to place? Was it through which form of wheels? Is it bus or car, or did you guys ride bikes, right? So when we think about the lived experience of our communities, we're thinking more, framing this work beyond the typical services and supports that all of us are engaged in. And we're really trying to shift our perspective to what are the community conditions that exist in the neighborhoods that we serve. So we know that our communities, based on historical context, they are facing a lot of different social, political, environmental, and economic challenges that really drive outcomes for our young children and families. And in the slide earlier that Breanna shared about racial systemic racism, and we're looking at these key life course outcomes, oftentimes the neighborhood and where you grow up really matters. So place really matters. Where a child grows up matters. Their neighborhood really matters. And in my example of taking you back to where you grew up, I'm sure that was very formative for you. And so First 5 LA invested a decade ago, invested in the Best Start Network investment. And really the belief was that families can flourish in strong and safe and engaged communities where parents and residents can come together with community-based organizations, other groups, and stakeholders to develop relationships with each other, to support each other, and to really ultimately act together to affect positive change in their communities. And the work of Best Start is really about directly impacting the different policies, investments, and services that exist in the communities of Los Angeles County. So can you go to the next slide, Breanna? So when I'm talking about the Best Start Network, it is really a network building approach to reducing disparities in our communities. And there's really three key components that I wanted to highlight. The work is very complex because it's a web of stakeholders, residents, communities, parents, and caregivers. But I really want to just focus on three components that may help generate some ideas for you. And there's so much to be said about this work, and I'm hoping that what I share right now will just spark some curiosity. And if anyone wants to, call me to have a meeting to learn more about some of this work, I'm always happy to do that. So hopefully this sparks some curiosity for you. So at the very core of the Best Start Network is this idea that we really need to invest our funds and resources into advancing community leadership. And so that means building power for residents and caregivers to be involved in the decisions that affect their everyday lives on those community conditions that I talked about in the previous slide. So every day there are policies being determined, there are policies being created without the input of our communities. And so through the Best Start Network, what we hope to do is to really center on community leadership. And a key value and a key practice of that is centering on the lived experience. And I understand that in the plenary session that we touched upon that. So what does it mean to center on the lived experience? Is that we're really inviting all the diverse perspectives and backgrounds in a particular community to really inform the strategies and solutions for the community change. And we do this in 5 different regions of LA County that have been identified as areas of high need. That's South LA region, the San Fernando Valley region, the Antelope Valley. There's a Central East LA part of the region, and then the port cities, which are Long Beach and Wilmington. So we focus our work in those 5 regions, and really with the understanding that all work is local, all change is local, and that we need to engage and build community power within these local levels so that we're bringing folks together to act together to not only strengthen their relationships, but also to in service of the community change that they seek for their families and their communities. And so an example of how this community leadership is advanced is placing high value on the type of data that shares lived experiences. So in the previous dashboards, we have one kind of data, which is really quantitative data that's gathered at the public department level, right? How are we also creating opportunities for community surveys that may be administered by residents themselves, speaking to each other about what are the conditions in this neighborhood and what do you think are the solutions for that? So placing high value on data that centers the lived experience is one way to really make that community leadership concept come alive. And so I guess sort of supporting the community leadership has to be this community-led change agenda process. And this process is more about the processes, the structure that is created to bring people together so that they can engage with each other, so that they can utilize data from their experiences, their lived experiences, and the quantitative data to understand these community conditions. So what that looks like in practice is you taking some of this data, you sense make with the community, CBOs, agencies coming together with the communities to say, let's take a look at this data and what does this data say about this local neighborhood? And what I really believe is that a lot of this work about data is just an opportunity for our communities to tell the story of their communities from their voice and from their lens. We know that data can often be used to further stereotype our communities, to validate those stereotypes. And we want to be careful about how we do that. And so when we are engaging our communities to participate in these inclusive processes, to sense make and create recommendations on these community conditions, we are really allowing them to tell the story of their community from their voice. In one of our regions, they created a Bill of Human Rights for systems change, and they underwent a 9-month process where they really centered their analysis on root causes of community condition and the challenges that exist in those community conditions that I talked about in the earlier slide. They used data on the lived experience of the residents who were involved in that process. They utilize quantitative data, and they really asked themselves, what is causing these issues that we see in our community? So really shifting the focus on, let's police our communities more. For example, let's police our communities more for the high level of drug use in our communities, to really asking, well, why does that happen? And what are the things that need to shift within our systems in terms of policies and practices that can reduce policing of Black and Brown communities? And so those were the kinds of solutions that really emerged to create this Bill of Human Rights for systems change. And it was a participatory process where the CBOs, agencies, and the residents came together in this process. And so the final kind of outer layer that I wanted to talk about is this role of systems partners. And that is really everyone in this room. The systems partners can be funders, they're public agencies, they're CBOs, there's foundations, and yes, CBOs are part of our system too. And so when we think about what is our role as partners to communities, to residents in the communities, it's really that we want to cultivate an authentic partnership. We want to cultivate an authentic relationship with our communities. And what does that mean? What does that even look like if you're desiring as an individual in this system that you work in, that you really feel strongly that you want to advance community leadership, that you really want communities to be leading the changes that they wish to seek in their neighborhoods. So then what does that mean for you as a partner to that? How do you cultivate that authentic partnership? So there's several principles I think that are really important that I've seen, and just really curious to see if these resonate with you and what other ideas you have. But one big thing is that we oftentimes systems partners can come in with our predetermined strategy and solution. We spend a lot of time in our organizations and agencies creating a strategic plan, and we bring that to the communities, and we try to drive certain solutions that we see as fulfilling the goals that we have laid out in our strategic plan. And so there, of course, needs to be some sense of strategy, but where is the room for us to come in with that curiosity that arises that will be fed through what we are hearing from our communities. Where are the opportunities for us to lead with trust of our communities, that they know their neighbors, that they know their communities, they know their children, and they know how to advance change in their communities. Another aspect of authentic partnership to me is really learning to uplift a learning process, this continuous learning that we need to do. And oftentimes we're really focused on blazing forward with the strategy, with implementation, and we need to intentionally build in moments to uplift what are we learning from this that will help us refine these strategies, because strategies always shift with the context of the community and the neighborhood, and we want to make sure that we are continuously learning to create more effective strategies for this work. Another really important aspect of an authentic partnership is around understanding how as we as systems partners, me by myself, I unintentionally contribute to the systemic inequities and biases. I come with my own lens, my own biases that were formed by how I grew up. And as much as we can individually take responsibility and ownership and walk in humility with communities, that we are oftentimes unintentionally contributing to these inequities, the more that we can be open to what arises from these dialogues that we have with our communities. And then the last one, which I think is really important, is that we want to direct resources to create and make space at the table for community leaders to inform decisions. And this is so important because I think that a lot of times we have this idea that community engagement is something you go out and do. You go out and do a listening tour, you invite residents to come speak at a public hearing. But authentic partnership means that you are sharing power and creating space at the table with resident and community leaders, and that agencies and CBOs are directing actual resources to creating those tables and bodies where residents can participate. One way that we did that in the Antelope Valley is that there were opportunities to fill a community chair role through our Antelope Valley Resource Infusion, which is a network of different agencies and organizations that invest in the Antelope Valley. And there were different community neighborhoods and that were represented on the AVRI committee. And there were opportunities for a community chair to, a chair role to be filled. And what our program officers did was specifically focus on finding Black community members who could lead in that community change role, to be bold and to say that we have not heard from Black voices in this work, and it is so important because they are a big population in the Antelope Valley. We want to make sure that we're going to work really hard and go to the furthest extent to fill these community chair roles with Black-led with Black leaders. And these leaders came from faith-based institutions with small grassroots organizations that never would have had the opportunity to really sit at those tables and inform decision-making. And then I think in terms of allocating and directing resources, we also need to honor that the relationships between community members and CBOs. Oftentimes CBOs are a trusted member of the community. They are driving a lot of change in our communities, and a lot of times our agencies do not fund the CBOs for those relationships that they hold with the communities. We learn a lot from those relationships that our CBOs have. And so how can we direct resources as agencies to really institutionalize those partnerships that we can have with our community-based organizations? So some examples of this in Los Angeles is the Promotora model. So we're acknowledging that individuals, especially in the health equity context, have relationships with communities and can have that culturally and linguistically accessible way of communicating and outreaching to the residents. But we have seen examples of how promotoras have gone beyond just the health equity to really work with communities to build power and work towards that community-led change agenda. Another aspect of the work that we have done at First 5 LA is working with stakeholders like LA Metro, a transportation and mobility agency, to really encourage them to directly contract with CBOs for their community engagement work. Whereas previously, and currently they still do, is they're working with maybe a private consultant who will then go out and work with our CBOs. But let's honor those relationships that our CBOs work hard to build with the residents, and put those resources towards the community engagement that our CBOs are already doing. That took a little longer than I thought it would. So I'm just going to go to the next slide, which is just a little outline of the different principles that Breanna and I both touched upon. And then I'm going to just open it up for conversation and questions. A lot of this you will have seen through our presentation. So one, we want to prioritize diverse community and stakeholder engagement. This means representation from representation in all the ways, right? A lot of times there was a question in our speaker kind of chat about what are resources for gender non-conforming individuals. So when we think about diversity, are we only thinking about race? Are we thinking about our Native American communities? Are we thinking about only able-bodied community members? So how do we prioritize diversity in all its forms and have an intersectional lens to the degree that we can? The second principle is that capacity building goes both ways. A lot of times we think of capacity building as something that we need to build for residents, right? Capacity building goes both ways. It is something that we also need to build capacity within systems partners to be able to really work in partnership with our communities. The third principle is around developing tools for ongoing transparency and accountability, so that it really invites everyone to the table in this work for pushing for equity, and making available that data for our CBOs and other partners. The fourth is investing equitably to achieve outcomes. Really encourage you to look more into the concept of targeted universalism. There's a lot out there coming from the UC Berkeley Othering and Belonging Institute. It's really interesting material that could, and I think they also have some practice guides. So what does it mean to invest equitably? Just take a look at that. And then finally, innovation is a journey, reflect and adjust often. And we do that, I mentioned, through learning and having the humility to say that our strategies are not set in stone, but they're evolving based on the dialogue that we have with our communities. So that concludes everything. Maybe we can just close out the presentation so we can see everyone's lovely faces, and if you all have any questions, just any reactions, doesn't have to necessarily be a question, please come off mute or share your thoughts in the chat.
Folks can also use the raised hand feature if you want to be put up in the queue, if you want to ask a question. But I'll ask you the first question, Debbie and Breanna, to get us started. I think, a lot of the work that we're doing here today is to mitigate and address toxic stress and advance ACEs. I know the work that you all are doing in LA County is really trying to center community to mitigate some of that. But as you all have heard the morning session and thinking about toxic stress, how does the work that you all are doing relate to ACEs? If you can speak a little bit about that.
Definitely. I think, both Debbie and I both touched on the impacts that the social determinants of health, can have on health factors. And we've seen the way that toxic stress directly materializes in adverse birth outcomes for, populations, particularly Black and African American mothers, where, the stress associated with racism, specifically associated with discrimination, creates a weathering effect on the bodies of Black mothers that basically contributes towards almost a premature aging of the body, where like the prime age of birth for that should be for most folks ends up being a higher risk for Black mothers because of the experience of racism, because of the experience of toxic stress along the way. And that doesn't just happen in adulthood. That's a cumulative effect from childhood onward, that builds up in the body, that reduces the ability of Black mothers to be able to give birth in healthy ways. And that's exacerbated by the way racism manifests in our healthcare systems and in our environment. and through the child delivery process. And so I think that's just one sort of concrete example of how toxic stress manifests and impacts the outcomes of both individuals and the families that are trying to serve. And so what this work does around focusing on health equity and thinking about the life course outcomes associated with this work is recognizing that in order for us to address racism, structural inequity, which is a root cause of many of the disparities that we see today, we have to think differently about how both government does business, but then also how it partners with community-based organizations and other stakeholders to be able to develop solutions to address those problems. And so, from a healthcare perspective, it might be like, oh, well, to reduce infant births, infant deaths, what we need to do is have better healthcare. But when you talk to the families, when you talk to the mothers who've experienced it, it's like, yeah, that's a part of it, but that's not the whole thing. What we really need is supports earlier on. We need to have doula care, not just in better healthcare within the healthcare system. We need to have, address racism early on in the life course. And that's what some of the investments that we've been promoting through the American Rescue Plan, it does just that. We're funding doula programs. We're funding, economic programs that can give folks more economic opportunity, that can reduce the stress, that contributes to some of those adverse childhood outcomes. We're promoting housing stability programs that can also reduce that toxic stress, contributing to those health outcomes. We're promoting alternatives to incarceration so that, when before jail is even an option, that there can be alternative routes that are more restorative and that address the root causes of the issues versus a punitive effect that ultimately has catalytic impacts on the households of those families. And I know that, First Five is doing very similar work, and not just thinking about what 0 to 5 children need, but also what the community needs to be able to create healthier conditions for the whole family to thrive, and address some of those adverse circumstances.
Yeah, and I see Jordan and Rosalia in the queue, and the only another angle that I will add is that in the community context, I think it's really important for systems partners to be able to show why is it that we need to address the disparate outcomes for Black and African American moms and babies. And so in one of our community meetings, there was a question from a non-Black resident about this. Like, why are we focusing on this? This is not necessarily my family, my community, right? So if we are truly driving equity, we need to be able to share with our communities that addressing the disparate outcomes within the Black community is really around addressing health equity for all of us, and that we are all interconnected in this way, all of our communities. So I think that's a little bit of the kind of framing that I hope that as we continue in this journey, this opportunity to kind of really push for better equity in our world, that we are able to kind of speak to how all of our communities are interconnected, and that this is not just about addressing the needs of one community, because Breanna's life and what happens to her is very much intertwined with my community. I come from the API community, but we are addressing health outcomes for all of us. So much more to say about this, but I wanted to kind of acknowledge that because that's coming up a lot in our work. So I have Jordan next in the queue. Go ahead, Jordan.
Ladies, thank you very much for taking my question. You guys do a lot of great work, so I want to applaud you for that.
Jordan, I don't think we can hear you. I'm so sorry. If you can get a little closer to your mic. We can hear you, but you're very far away.
Okay. Is that a little bit better? Is that better by chance?
Yes, I can hear you now.
Okay, sorry about that. Anyway, like I was saying, ladies, thank you so much for your presentation. A lot of good information. You give me some great ideas. But I did want to ask you just a quick question. So here in Greenfield, we deal with a lot of families that are not necessarily as tech savvy as we would like. And then because of the pandemic and everything, it's been kind of hard to start bringing them back into the fold when it comes to getting input and trying to meet their needs and everything else. And just like as you've described with trying to bring them back to the table, for a community like this that is not necessarily as tech savvy as we'd like, and then also we deal with a lot of families that are either immigrants, or they don't want to necessarily identify their resident status. Just kind of talking through that, how would you feel? I mean, how do you guys think that we should go about, or I should go about engaging these families and kind of bringing them back into the fold so that we can have a more equitable system of services?
Yeah, that's a great question, Jordan. I'm going to repeat for those who weren't able to hear,
Thank you.
but essentially in the community of Greenfield, there are a lot of families who aren't as tech savvy as maybe in other communities. And so with the pandemic and things going to remote, it's been difficult to bring some of those families and stakeholders back to the fold to be able to benefit from the services. And there's also, other barriers around like immigration status and others where people may not want to necessarily share those things. So how can what are some recommendations, strategies for being able to reach those populations and overcome, some of those barriers to access? As it relates to both technology and then various, documentation statuses. Did I capture that correctly, Jordan? Okay, perfect. Debbie, do you want to take a first take at that?
Yeah, Jordan, I feel like that's the million-dollar question that we are all struggling with right now. And unfortunately, I don't really have an easy answer for you. It's been a challenge with all of our grantees and partners in the field. Like, I think this is the question, right? So some things that I have seen happen, aside from, I think that there's always this concept of creating like a parent group, right? Because we have to recognize that this is not the easy answer, but this work is all about relationships, right? So it's about who has a relationship with who in this community. In your instance, it's the parent community, right? So we want to focus on what are spaces that we can create to cultivate those relationships, right? That's with like those parent advisory groups that you can kind of congregate. I know that there are different groups that you can create based on their identity and how they affiliate themselves, right? So that's kind of like the targeted universal approach to creating a space where folks feel comfortable. It could be in the language that they want, with other peers that have similar immigration status. So there's that. There is some stuff that I've seen that CBOs have actually purchased things like iPads and equipment so that they can be checked out and that community members can utilize that. And it's not for personal use, it is for the use of creating a community change agenda. So knowing that the person who is utilizing the equipment is doing so not out of their personal benefit, but as a representative of the community wanting to advance community change. So I have even seen some organizations go so far as to have that equipment and rent that out. And maybe that is the radical change that we really need in terms of access. There's no real way around it, right? That unless we kind of create that access for our families. I'm gonna think of other stuff, but Breanna, do you have anything to add?
Yeah, no, I think that captures it pretty well. I will say in the plenary session, there was talk about the influx of both state and federal funds coming into Kern County. And, I do want to flag that with the federal infrastructure bill, broadband infrastructure and internet access was identified as an infrastructure, need. And so there are billions of dollars dedicated to the distribution of broadband, of computers, of training in technology to be able to support folks and being able to access that. And so, I would highly encourage and a focus on rural areas too. And I know that there are some rural areas within Kern County. So, I would encourage, there to be some strategies around applying for some of those grant programs related to that. I think to Debbie's point, this is sort of the way that our world is formulating. It's becoming a more and more digital world. And I think to the degree that we can equip folks to be able to fully participate in our growingly digital world, to meet both educational and economic opportunities, I think the better. And also, as I mentioned, like capacity building goes both ways. So yes, we can strengthen folks' capacity around giving them access to technology and training, but then we also need to figure out what are some of the strategies that can meet them where they are. And I think a part of that is just by asking them, I would reach out to folks and just say, what is your primary preferred way of being able to connect, and develop those strategies tailored to their preferences and needs.
Yeah, and Jordan, you're an educator, so I don't have to tell you this, but it is all about how you ask the question and what question is being asked, right? If the question is about how can we get you to participate more, it's almost like extracting something more out of them from their day, right? The question can be, how can we create a community where you feel like you belong, where you and your family feel a sense of belonging and inclusion? And that shift may open a new way of families kind of engaging with you, right? I don't know how you orient to this work. People come to this work in different ways. Some people are all about, give me some strategies that I can test out. I myself am I kind of need to have a framework and a way of operating to just understand what are the strategies. And so a framework around belonging and inclusion that can open up some new perspectives and how the kind of data that you gather from your families.
Thanks, Debbie. All right, I see Rosalia is also in the queue, and I think we have five. I just got a 5-minute warning, so.
Yeah.
Thank you, everybody. I just wanted to say thank you for this great information. The reason why I wanted to ask you guys was, and also tag in Hector on this, because yes, we're talking LA County, but I also wanted to know, do we have something like that here in Kern County? And if we do, who is it? And then the next thing I want to say is, I'm coming from the lens, not only did I live in poverty as a child, I went through every single thing that you said down the road. And also I kind of put myself going through school the same way, looking at it, now that I'm educated and I have this job, I look at it as a platform because I deal with, I do case management for children 0 to 5. And basically these families come to me and they ask me these questions. So I also get to know from their point of views of what's going on. So I can kind of tie everything together. And knowing that I work at the Family Resource Center, I always try to make sure that I educate myself with the different types of resources that we have in this community. So if you tell me something, I try to know everything. So that way I can be able to educate it right back to my clients. So with that being said, if you guys can be able to answer me those questions and see how other ways that I can be able to help. I know I've been trying to figure out, how do I get on something like this?
I could try to take a stab at it first for the Kern County perspective. So Rosalia, my goal today of inviting Breanna and Debbie is to share an example of what's happening in LA County, right? As an epicenter of the intersection between different communities and what that happens. I think I wanted to create a learning space so that we can generate ideas and take what's already happening here in Kern County and thinking about how do we operationalize this, right? We heard about the adoption of an anti-racism lens by the Board of Supervisors, right? That's something that we can push here in Kern County. We heard about different engagement strategies that we could deploy to support that work, right? First Five Kern, in the work that it's been doing to support ACEs, is doing that, building out the ecosystem of partners engaged in this work so that together that we can act and work together alongside community and to really design principles that center their lived experiences, that center the work. And we're doing that here in Kern County through our home visiting work, through our medically vulnerable care coordination work that we're supporting, through the FRCs that we convene, the Kern County Network of Children that comes together monthly to do kind of capacity building. And so the work is already happening here in Kern County. And what I hope today lend was an example of what that work can translate into, right? Into data that we can map and visualize for our communities, into investments that happen geographically based on need, into opportunities for all of you in this room to be advocates for the families that you're serving, to bring alongside those families to advocate for themselves to our elected leaders. Today, we heard from Assemblymember Rudy Salas, Senator Melissa Hurtado around like, hey, their doors are open. So let's take that invitation and have them be our advocates and allies in Sacramento to bring in those additional resources to help fund those strategies that will help support the communities here in Kern County. And so there's no silver answer or how we move this work. I think it's like, being innovative, not being scared to challenge the status quo and to think outside the box. And it starts with all of us. And if you have those ideas, bring them to the table and let's figure out a way to make them actionable. So I'll stop there.
Oh, drop the mic, Hector.
Yeah.
No, I think that's right on. I feel like we gave our examples of things, but one thing I will say is everything that happened in Los Angeles County happened because of community advocacy. The board of
Yes.
directors would not have taken the actions that they took without having community advocates saying racism is an issue. We're seeing Black and brown folk die at unprecedented rates because, you know, there's systems in place that are allowing for that to happen or exacerbating those inequities. We need to have a change in how we're doing things. And as a result of that advocacy, the board took the leadership to be able to act on the requests of its constituents. So there's so much power that each and every one of you have in being able to bring these ideas or others that you may have to light. But this is an example because, you know, LA County is a behemoth, 10 million people in the county. You know, folks often say, oh, that's LA County, it's different. But honestly, if it can be done there, it can be done anywhere because it's complex. It's the dynamics are very, you know, unique, and we're still able to accomplish some of these things. So, Debbie.
Yeah, I mean, Rosalia, it's so hard because you are one person in your FRC and in this system. And I hear what you're asking is like, what can I do as a case manager, right? And I really believe that that's the work about this equity is that it just starts small. It starts with one person building a relationship with the next person and building power in that way. So you have power and authority to advance things that are near and dear to your heart, that give you energy, that bring your clients joy. So some examples of that I've seen happening is at an organization down here, they were trying to get parents to come and join this group. And it's like, you know, another one of those advisory groups where you kind of meet to kind of push different practices and policies. And they had said, we want to know how we can help you. And I think a lot of times parents who are in certain conditions in a certain stage of life, it can be exhausting to kind of constantly feel like you're an empty cup that needs to be filled by services and supports, right? So when that organization shifted the question to say, we need your expertise and your leadership to guide how we can change and improve our community, all of a sudden they got all these people who were interested in joining this parent leadership team. And so that's just, it's just kind of a shift in perspective that I think it just starts with you saying, I don't want to see parents as empty cups that need to be filled. They are full of life. They're full of experiences and knowledge, and they can guide how we create solutions. So that's one thing. There's another family resource center in the Antelope Valley that as they were creating the family resource center, they basically said, we're not going to predetermine the services. We're going to say, go to the community and say, what services do you want? What organizations do you want to be housed in our family resource center? And which is, to me, kind of radical because they didn't go in with a preset notion of who should be here and what services do you people need. They said, no, we're going to just not go in with any preconceived strategies. We're going to ask the community, what is it that you want? And so I just think it's like all about shifting the framing of like what you ask and how you engage to really honor people's lived experiences. That's how we talked about it. But yeah, those are just some ideas for you to think about and maybe even just like noodle over with your colleagues.
Thank you.
Thank you so much for the question, Rosalia. I know we're running up on time, folks. You know, Debbie, Breanna, you have been phenomenal in kind of sharing the real world examples of how we operationalize equity, how we do that across government, across community-based organizations, and then most importantly, within the lived experiences of the communities that we're working day in and day out to serve. I know Breanna and Debbie shared a couple of links in the chat. Feel free, to connect with them via the Whova app. If folks have questions, can relay those to them. So today, it's a day about learning. It's a day about asking those questions, Rosalia, around like how can we move this work forward? And the invitation is like, let's be curious together. Let's strategize and get into some good trouble around making some of this work feasible and a reality for the communities. We have a number of folks, First Five Kern, some of our elected officials who are our supports, and I think most important, you all. And so again, Breanna, Debbie, thank you so much for your time, energy, passion, dedication to move this work forward. You all are phenomenal women, and glad that I can call you my friends and former colleagues to really support this work as we operationalize equity, not only in LA County, but here in Kern County and the greater state. Couple of household items, folks. So lunch is from 12:30 to 1:30. There is a live Q&A with some of the organizations that are on the Hoover app. If you want to connect with them, learn a little bit about what they're doing, connect with resources, that you'll do that. And then at 1:45, the next workshop series starts. So again, figure out what you want to attend. Click on those links. They should have been emailed to you, or they're available through the Hoover app. And after that, the plenary session will start at 3 p.m. And it'll be, again, a Zoom webinar with some of our regional and state level folks to talk about ACEs and how we move this work moving forward over the next couple of years. Debbie, Breanna, I'll give you the last word to see if there's anything else you want to close with before we leave.
Nothing from me, just really energized by this conversation and all the curiosity that you all are holding. Would love to keep dialoguing with you, so feel free to reach out to me and Breanna. And yeah, I'm really excited for what's to come for Kern County.
Same here. It's really been a pleasure being in conversation with you all. I'm looking forward to hopefully being able to work together and support each other in our journey towards more health equity and more innovation in how we do this work. Thank you.
Perfect. Thank you so much, folks. Well, that's it, folks. If happy lunch, or if you're going to go visit the virtual vendors, the link has been emailed to you all. So thank you for your time, and I hope you enjoyed the conference. We'll post the recording once we have them on our YouTube page, and we'll send it out to folks. Thank you so much.